Good afternoon. Welcome to Living Well with Dr. Bell, the March episode. I want to thank Dr. Thaddeus John Bell, our physician from North Charleston, South Carolina, for being here with us. Good afternoon, Dr. Bell.
Good afternoon, Joe. How you doing today?
Doing well. Good to be with you again. And I also want to introduce Dr. Kelenne Tuitt, a family practice physician and internist in Bamberg, South Carolina, who is our special guest for today. As you know, March is Women's History Month, and we are going to tie this episode to I'm Every Woman. And we are looking at health issues for women. AARP South Carolina recently conducted health disparities research, and we found in women that are 50 years and older that obesity occurs at a high rate, almost 54% higher rate than non-Hispanic whites. And so today's episode, we've got questions along those lines for Dr. Tuitt as well as Dr. Bell. But we'll begin with Dr. Tuitt. Dr. Tuitt, can you please talk with us about the steps that women can take to prevent obesity?
Hi, thank you for having me on this show. So obesity can start from actually a young age. It's usually things that we learn from our parents in terms of how to cook our meals, in terms of our physical activity, in terms of things that we drink. So first things I usually advise patients to do is to look at what they take into their body during the day. So if you can eliminate sugary drinks such as sodas and sweet tea and juice and just drink water, that will cut down on a lot of calories and you'll start to lose weight automatically within the first week. And then the next step is just incorporating simple things into your day. A lot of times people make a big to do about what kinds of physical activity that they do. And all they have to do is simply walk. On your lunch break, maybe take half of the time to walk 15 minutes. Maybe park your car a little further away in the parking lot and walk to your job. Take the stairs instead of the elevator. Those simple steps will actually help you to lose a little bit of weight during your weekly activities.
Great. Those are great. That's great recommendations for our viewers. I want to remind our viewers that this Lunch and Learn is available to you on a monthly basis. And if you have questions, if you'll put those into our chat function, we will respond to those questions. Dr. Bell does an excellent job of responding. So if you've got questions, please put those into chat. I want to move forward, Dr. Tuitt and Dr.
Bill, can I make a comment just to add?
Absolutely.
To Dr. Tuitt's comments? She mentioned exercise. So exercise is a very important part of that prescription that she just gave. So if you do 30 minutes a day, 5 days a week, that will give you 150 minutes per week. And I'm recommending strongly that exercise that you do is walking.
Okay.
It's easy and it's enjoyable. You know, we want to make people recognize that exercise is enjoyable, particularly if you're doing it with someone that you enjoy being with. So I definitely would recommend that as a part of the exercise prescription that Dr. Tuitt recommended.
Excellent recommendations. And with the weather getting warmer and daylight savings times, the time change will have more daylight to be out and to walk. So they're encouraging us. These are family practice physicians giving us real life examples of things that we can incorporate into our day so that it improves our health. So thank you for those recommendations. As we look at heart disease is another health issue for women. When we look at the warning signs for women, Dr. Tuitt, I know that it can be different for women than it is for men. Can you talk to us about those warning signs that women should look for when it comes to a heart attack?
Yes. So a lot of times when someone thinks of a heart attack, they think they're having crushing chest pain, or a common descriptor is they feel like an elephant sitting on their chest, like a heaviness. But in women, oftentimes a heart attack can be missed because they are the signs don't present similarly to men. So in women, sometimes they may feel very tired. They may get lightheaded or dizzy. They may have pain that goes into the jaw, into the neck, the back, or down their arms. They may also feel short of breath. So usually if they could walk from their room to the bathroom without an issue, all of a sudden they're having difficulty with just short exertions, short moments of exertion. They may also experience heartburn. So you may think, oh, I'll take a Tums or a Pepcid, but indeed you're really having a heart attack. So if you have any of those symptoms, I strongly encourage you to go see your physician to get that evaluated.
Okay, very good. Dr. Bell?
I certainly would, the recommendations that she has given are spot on. I knew this question was going to come up. So I went back and I looked at the most common symptom that young women with heart attacks have. And by the way, I want to make you aware that heart attacks are common in young women.
Okay.
It is fatigue that is the most common symptom that women have. And as Dr. Tuitt pointed out, the symptoms for men and the symptoms for women are very different. Mm-hmm. So if you have an acute onset of fatigue, or I like to say impending doom, if you feel like you're about to die, all right, you should pay attention to that. But you should not drink some water and just decide you're going to go to bed. Okay. You should call 911, tell them what you think, and let them make the diagnosis of a heart attack or whatever it may be. But just remember, as Dr. Tuitt pointed out, heart disease is the number one cause of death in African American women. And so,
I've often heard folks say too with women that there sometimes women experience back pain. Is that one of the symptoms that women experience often with heart attack?
Yes, you can have back pain. It can go into your neck or your shoulder. So sometimes patients may say, or women will say, oh, I thought I just pulled something or I lifted something, but indeed the pain is going into their shoulder and into their back, more so on the left side. And that can be a form of, or a sign of a heart attack.
Wow.
You can also experience some GI symptoms. And so the other thing that we should point out.
Now, Dr. Bell, you say GI. Tell us what GI is.
I'm sorry. Gastrointestinal symptoms.
Okay.
Stomach problems, diarrhea, nausea, vomiting. Those are very, very common GI symptoms, gastrointestinal symptoms. Mm-hmm. Of course, we also want to point out that you should be familiar with your family history because heart disease runs in families. Mm-hmm. If you have a mother or a father who had a cardiac episode, a heart episode, then you need to tell your doctor because he needs to evaluate you and give you additional information as it relates to that. Kelenne, I'm sure you probably have picked up on several patients who have presented to you like that.
Yes, usually one of the screening questions for my younger patients are, did you have a family member who had a heart attack before the age of 50? Because that's a strong indicator that you are at a higher risk for heart disease, and screening can actually prevent you from having a heart attack or some form of heart disease. So it's very important that as physicians, we ask that question, or if you know that you have a family member, meaning a first-degree family member, such as your mother, your father, a sibling, or a child that had heart disease, you should inquire about getting heart disease testing or screening.
Excellent.
One other point too. In the past, we have kind of downplayed when women present to the emergency room, and men doctors have not taken their symptoms seriously. But now that we have more women like Kelenne who are in the medical profession, more cardiologists who are in the medical profession, we are doing more research. And so a lot of the information that we are giving you is really fairly new because we have spent more time recognizing that the symptoms for heart disease in men and women are different. And in the past, men doctors have not paid enough attention to the symptoms that women have when they present to the emergency room.
Excellent. Well, that is excellent information, excellent recommendations for us as women as we look at our bodies and consider our health, to remember those recommendations and those early warning signs and symptoms that we need to look for when it comes to being heart healthy. Let's move to our next question, which is in regards, Dr. Tuitt, to breast health and the importance of early detection when it comes to breast cancer.
Yes. So for women, especially if they've had a family member, first degree relative, so that's your mother, and also men can get breast disease. So if you've had a father or siblings that have had breast cancer, it is important that you start to get your mammogram at least 10 years before or from the date that their parents were diagnosed. If you don't have any of those risk factors, or if you've done genetic testing and you don't have a gene called the BRCA1 gene, which puts you at a higher risk for breast cancer, you would start screening for your mammograms from age 45 and up. It used to be 40, but now they say you can start at 45. Usually they recommend screening every year from the ages of 45 to 54. And then once you hit 55, you can do it every 2 years. I do recommend that patients examine their breast. They know their body better than anybody else. And if they feel something abnormal, if they see any nipple discharge, if they see any changes in the shape, size, or the dimpling in their breast, they should go see their primary care doctor so that they can get their breast examined and see if they need to have any further testing. If you have a history of getting mammograms and it says you have dense breast tissue, there is a newer form of mammograms called a 3D mammogram that can actually pick up on breast cancer changes sooner than a regular mammogram. So I would ask about having those special tests done if you know your doctor has told you that you had dense breast tissue.
Okay, very good. Now, Dr. Kelenne, I've heard that oftentimes it is a husband or a partner that might find the lump on a woman. Can you talk to us and tell us, is that true? I mean, tell us about that experience.
Yes, a lot of times women are afraid to touch themselves, unfortunately. And we usually recommend the best time to check yourself is either laying down flat or while standing up in the shower. And you actually have breast tissue that goes up underneath your collarbone. And so you want to check all the way around in a circular fashion, all the way to the nipple and also into the armpit. But a lot of times, if you're intimate with your partner, they can sense things differently that you don't necessarily feel. And once they notify you of that, you should certainly go and get that checked out.
Okay, very good. Great.
I remember very well, I had a patient to come in, and she and her husband were intimate the night before, and he was the one who discovered the lump in her breast. And they both came in to see me, and sure enough, she did have a lump in her breast, and sure enough, she ended up having cancer.
Wow.
But the interesting thing that she was concerned about was that the diagnosis of breast cancer was going to change the relationship between she and her husband. Mm-hmm. And of course, she had heard that this was a common occurrence. Mm-hmm. This did not happen, but I can tell you that it, particularly with a lot of younger women, it is a major fear that women harbor, and sometimes they will not let their partners know that they have a lump or they're experiencing some kind of issue. But I just wanted to put that out there to let women know that we are trying to change that, and that a lot of men today are very sensitive about these kinds of issues. And if you feel that your husband may have some issues with that, then you may want to go to your doctor, and the two of you all go for therapy or whatever that's needed in order to appropriately deal with that issue. Because as a woman is going through treatment for any kind of cancer, right, she definitely is going to need support from her significant other.
Thank you. Thank you. Great information. And Dr. Tuitt, I appreciate the fact that you informed our viewers that if in fact they know that they have dense breasts, to ask for that 3D mammography. And so that is the kind of information that once we share that information, our viewers can act on it. So thank you. Good information from both of you, Dr. Bell and Dr. Tuitt. Let's have another question. And this one is in regards to your weight is your fate, and how we need to take control of our weight in order to control disease. So Dr. Tuitt, I'll start with you. Can you share some insights, some pearls of wisdom with us in regards to proper weight management?
Yes. So a lot of times for women, we carry a lot of our weight around our waistline. Mm-hmm. And that is directly correlated with a higher incidence of heart disease, diabetes, high blood pressure, high cholesterol. And having a combination of all of those, including being over the age of 50, mm-hmm, puts you at a higher risk of death. So you're essentially shortening your lifespan. And so if you know that you are struggling with weight loss, certainly making small lifestyle changes will definitely help you. Having a lot of, now everybody has a different shape. You have the people who are top heavy, bottom heavy, and then people who have like that hourglass shape. But if you are carrying a lot of weight around your waistline, that actually puts you at a much higher risk. Now, you do have some patients that are very slim and slender, and you think, oh, they're very healthy. But some of those patients, they've done studies where they've done CAT scans, and they saw that they had a lot of fat surrounding their organs. They actually have a higher risk of heart disease and death than someone that you see that is obese or overweight. So just because someone's skinny doesn't mean that they're very healthy. Mm-hmm. So certainly making lifestyle changes. So trying to cook at home, certainly teaching your children how to cook healthy and making it a family effort will help you be more successful in eating healthier. Eliminating your saturated fats, your fried foods, maybe purchasing an air fryer because you're using less oils and fats, eating out less, certainly drinking less soda, less juice. Those things reduce your calorie intake. Mm-hmm. And again, exercise, getting 150 minutes in every week can help you reduce your weight, reduce that central obesity around your waistline, and actually increase your lifetime so that you can enjoy your family and your grandchildren.
Excellent. Excellent. Yeah. Dr. Bell, any pearls of wisdom in regards to our weight being our fate?
I'm always walking on eggshells when I talk about obesity in African-American women, because I must admit I've gotten myself into some trouble.
I'm sure.
discussing this issue. And over the years, I have learned some things. But the wisdom that I would give is that number one, weigh yourself on a regular basis. Don't be afraid to get on the scale, because the only way that you are going to know that you are gaining weight is that you gotta weigh yourself about once a week. I consider weight as a vital sign. It's just that important. It is just as important as knowing your blood pressure and your pulse.
Mm-hmm.
Knowing your weight is very, very important, because lots of times I hear that women will say, well, I was not aware that I was as heavy as I am until I stepped on the scale. And one of the things that women do not like to do when they come to my office, because I will do the scale, and they always ask, do I have to?
That's me. I'm guilty.
Okay, but we just want to know. We just want to let people know that it is that important. And then one final thing, you should be suspect if you continue to go to the doctor and you know you're overweight and your doctor has not said anything to you about that. That is not good. Okay. That is not good. So even if you don't like it, if your doctor says something to you about it and brings it to your attention, he's doing his job. He's trying to save your life. And as Dr. Kelenne pointed out, then you should do the kinds of things that you need to do in order to make sure that we have. Dr. Kelenne, I don't want to put you on the spot, but can you mention a little something about the BMI?
Yes. So your body mass index is a tool that we use that takes your weight, and it's based on your height to measure where you are in terms of an obesity scale. So if your BMI is between, I think it's 17 to 29.5, you are considered, 17 to 24, you're considered normal weight. If you're between 25 and 29, you're considered overweight. And if your BMI is over 30, you're considered to be obese. And there are different classes of obesity. So even when you are considered overweight, there are simple things you can do. And even 5 pounds can take you from being overweight to being in the normal range. And so once you know your numbers, you can take control of how you can change the course of which direction you're going. Another way to know that you're gaining weight is that when you sit down and at home or at the office and you have to unbutton your pants, or you have to wear sweatpants instead of wearing regular jeans, that's a sign you're gaining weight. Don't give into it and go buy a larger size. You need to do something about it. So,
if you can't bend over and tie your shoe,
exactly.
You have to get somebody to tie your shoe for you. And you know you're not headed in the right direction.
Right,
so
right.
it is an issue that doctors have and that everybody has. But I have noticed that women who have decided that they're going to lose with a combination of eating the right thing and exercise and recognizing the kind of stressors that will cause you to eat the wrong thing and eat junk food. Once you have an idea of all of those things, you can control this. But obesity is definitely a problem in the African American community, and we see it, unfortunately, in African American women in most of the southern states.
Yeah.
Mm-hmm.
Yeah.
And Dr. Bell, that's true. And I laugh because I'm guilty. When I go to the doctor, I want to take off everything I can to make sure that the scale doesn't say more than I think it should say, But we've done the research, and we've done 2 studies here at AARP South Carolina on health disparities among the 50 plus. And unfortunately, while it's not new information, it is often tied together. in regards to the obesity tied to heart disease, which is tied to stroke and diabetes, as well as uh, Alzheimer's and colon rectal cancer. So it's all so interconnected, and it really is important for our viewers to understand that the information and the resources that are being shared with us here today. These are two family practice physicians who are working on these issues day in and day out. We can take their guidance, their recommendation, and if nothing more, then go back and say, okay, I was listening to this Facebook Live segment, and I heard the doctor say, make sure you get a 3D mammogram. That is good information that we can share with our viewers. Right. And so I just thank you for your willingness to come on and share information with us to address these health disparities that we're facing here in South Carolina, and to hopefully improve the health literacy so that people understand what it is that we're dealing with and how they can help to take a positive step to address it. Dr. Kelenne, we're coming up on the last few minutes of this segment. I tell you, this 30 minutes of a Lunch and Learn goes by really quickly. You've given us great advice today, great information you've shared. Dr. Bell, it's always the same with you. I think let's end on a high note. And let's just end with, we've heard that acts of kindness can impact both the person who is performing the act of kindness as well as the person who is receiving the act of kindness. Can you talk about the positive impact of just being kind, simply being kind?
Yes, you never know what people are going through each day. You may see someone, they're down, or they may be smiling and they're really hurting on the inside. And just when you walk into a room, smile at someone, say hello, don't walk right by them. That might just be a sign of someone cares. Nowadays, we don't ask people, how are you, and truly listen. We just ask it, and we usually give that general statement, oh, I'm fine. But sit down and ask them, like, how are you really? What's going on? How can I help you? A lot of times with my patients, so I'm currently transitioning from 2 different offices, and I really didn't know how much my patients appreciated me until they kind of actually cried and was wondering why I was leaving. And that brought joy to me because I knew I was making an impact in that community. And it was sad for me to leave that community, but I knew I had to and spread my gift essentially with others. Mm-hmm. And it really brought me joy knowing that some of them actually want to follow me where I'm going. So knowing that what we're doing as physicians actually impacts patients' lives is a true gift. When I see a patient come in and their A1C has come down or they've lost 2 pounds, I'm cheering them on and they feel so excited, and it motivates them to continue doing a great job. So just saying hello and listening to patients and smiling and appreciating them can definitely change somebody's day. I always try to make my patients laugh so that they know that, you know what, I care about them and that I'm not just here to tell you what to do, but I'm truly a part of your team and your family.
That's right. Yep. Absolutely. Absolutely. Yeah. Dr. Bell?
Well, the only thing I can do is just smile at what Dr. Kelenne said, because she's absolutely right. And I just want to express my sincere appreciation for having her join us. And this is not the only time that you will be hearing from her.
Exactly. Well, when we look at the work that we're doing here, trying to address the health disparities and understanding the environment that we're in with folks, right now we are in the midst of coming, I guess, out of a pandemic. Dr. Bell, can you just speak real quickly on where we are and where we're headed in regards to COVID-19? And then Dr. Kelenne, if you'll jump in and also.
We are coming, they say we are coming out of a pandemic, but I have noticed that in the hospital, they're still making people wear masks. In my office, I'm still asking folk to wear their mask, and I wear my mask. I recognize what the CDC is saying on the outside you don't have to wear a mask if you're socially distanced from around people, but on the inside. I'm just reminding people that the pandemic has not gone away. Only 60% of the population has received the vaccine. We almost have had 1 million people to die. And a lot of the experts are thinking that we are going to see another variant before this is all over with. So I would say stay tuned, do the things that you know to do to protect yourself, take care of your medical problems.
Yes, thank you. And Dr. Kelenne?
Yes, I agree. We talked about high blood pressure and obesity. Obesity is one of the number one risk factors for COVID-19. So certainly working on those things to kind of reduce your risk of having complications from COVID-19 will benefit you and make sure you get vaccinated.
Excellent. Well, great information that you've shared. Thank you for being here with us today and providing this segment for us. We look forward to seeing everyone back the first Friday in April. Until next time, thank you. Stay safe.
Thank you.